Hi, I'm Steve Rowe, CEO at Oak Knoll. I'm recording this message the morning of Thursday, November 7th, and it will be uploaded and available to you later today. Happy December. I'm going to start with the COVID update, probably not unexpectedly, but we have seen the COVID cases rise a little bit over the last couple of weeks since the Thanksgiving holiday. There are currently 4 employees out with COVID. We also have 2 residents in nursing care and 2 independent living residents at the main campus who are COVID positive right now and are quarantined either in their rooms in the health center or in their apartments at the main campus. Fortunately, none of the people are very sick. Some, except for testing because of potential exposures, we probably wouldn't have even known that they were COVID positive. Nevertheless, we do have 4 residents and 4 staff members who are COVID positive at this point in time. If you are not feeling well, please stay home. We really do want to get ahead of this and kind of knock it out again before it continues to spread through the buildings. So if you're not feeling well, please stay home, and hopefully in the next couple of weeks we'll get back to a caseload of 0. Thank you for that. We have resumed wearing masks in the health center while we have the 2 positive resident cases in the health center. So just be aware of that. If you're visiting a friend or a loved one in the health center, there are masks available at the doors to the health center. But just please do, we ask visitors to please help us and wear a mask. All of the staff are masked as well. Kim Bergen-Jackson and Sarah Ruhlman have been reporting to Johnson County Public Health and the Department of Health and Human Services, and they've also done an excellent job communicating with family members of residents who have COVID. So enough about COVID. Last night was the Planning and Zoning Commission meeting that I had talked about 2 weeks ago. Our rezoning request for the 1201 West Benton property was on the agenda, and we had several people from Oak Knoll speak at the public hearing. So Kim Bergen-Jackson, our administrator, talked about the small house model of nursing home care. Jack Top, the architect who we have been working with from OPN Architects, talked about the design and trying to preserve as many of the trees as possible. Brian Belk is the engineer who we've been working with from Axiom Consultants, and he talked about the property itself and how much of the property we cover with our building. And then we also had a couple of other people from Oak Knoll that were in attendance and did not speak. One of our residents, Wetherill Winder, was there, so thank you to Wetherill for being there, and it was nice to see your face in the audience. And then Tom Bender is the vice president of our board of directors, and Tom was in attendance as well. We did successfully get through that first hurdle. The Planning and Zoning Commission did approve our request with a 5-0 vote. So all 5 members who voted were supportive of the request, even though there was one couple who they don't own a property, they rent a property in the Oak Knoll neighborhood, and they were very much against this proposal. Their concerns were related to traffic and the parking that happens along the streets whenever we have a big event, and they thought this would just add to that issue. I disagree with that. I don't think the type of building that we are planning for this will add any significant traffic. Benton Street is already a very busy street, and we think that this is a good plan for us. The idea is that we will serve 12 nursing level residents in this building, and it would be a small house, so pretty much everything that those residents would need would be in that house. So there'd be dining and recreation space and family space, and 12 private rooms for the residents that we're caring for. So we passed the first hurdle. The next step now is that it will go to the City Council, and for City Council there will be 3 considerations of the rezoning request. If all goes well, the first of those requests or first of those considerations would be at their council meeting on January 2nd, and the third and final one would be at the council meeting on February 6th. So hopefully by early February we will have gotten through approval at City Council, and assuming that that happens, then the next step is to go to the state to obtain a certificate of need for the additional nursing beds. That is not a given either, because as of July 1st, the state of Iowa put a moratorium on new nursing home beds. Kim and I are working with the attorney who we used last when we added the 10 nursing beds that created the short stay unit back in 2016 or 2017. It was probably 2016. We're working with that attorney. His name is Bill Boyd, and we are drafting a letter asking for a waiver from this moratorium so that we can actually pursue additional licensed nursing beds. And we're hopeful that that will happen, but it's like, and it doesn't make any sense to start that process until after we have the city approval completed. So there's still more to come. We will keep you updated every step along the way, but at least step 1 is complete. We successfully got through the Planning and Zoning Commission. New topic for anyone who is interested in contributing to the annual holiday gift from residents to staff. The deadline is fast approaching. If you are planning to contribute, please do that by next Tuesday. The checks should be made out to the Oaknall Foundation with a memo line for holiday gift. And on Wednesday, we will actually process that gift through our payroll system, and it will be distributed to employees next Friday, December 15th, I think is the date. So just be aware, it's like that deadline is coming quickly. If you are planning to contribute, please make your contribution prior to next Tuesday. And finally, the monthly resident council meeting is scheduled for next Wednesday afternoon at 1 o'clock. It will be held at the East Campus in the community room. Visitors are always welcome to observe the council meeting, so if that's something that you're at all interested in, Wednesday, 1 o'clock at the East Campus community room. That's all I have for you today. Hope you're doing well, and we'll talk with you again in a couple weeks. Take care.